And we now talk to OCTA Research Fellow Professor Guido David, and he joins us live via Zoom. Good morning, Professor. Thanks, as always, for joining us. Tell us, what are your thoughts on Metro Manila remaining under Alert Level 1 despite the projected increase in cases and the detection of more cases with the Omicron subvariants?
Hi, good morning, Ria. We actually support the Metro Manila remaining at Alert Level 1. The reason is that we're not projecting a big surge like what happened in January or even last year. So we're projecting perhaps a few hundred cases at the peak of the surge in Metro Manila, which would not really affect the healthcare too much. That being said, Ria, if the numbers increase beyond the projections, there should be room to reevaluate the system or the alert level status.
All right, but so far we seem to be in a fairly good place. Tell us exactly where we are. What is the situation in terms of the positivity and reproduction rate? And again, is that something we need to be alarmed about? Right,
Ria. So in Metro Manila, the ADAR is still below 1, so that's good. But it's at 0.99, so it's very close to 1. And once it exceeds 1, then it moves to a different risk category. The reproduction number is 1.56. It's still very high. The positivity rate has increased to 3.3%. This is the weekly positivity rate, while the healthcare utilization is still very low at 23%. So based on our metrics, and this is our metrics, it's not necessarily the same as the one used by the Department of Health. Metro Manila has moved from low to moderate risk. That being said, again, moderate risk does not translate to an escalation of the alert level because we're still looking at the healthcare utilization, and it's still very low at this time.
All right, well, that is a spot of good news. Now, you mentioned the ADAR is at 0.99, very close to 1. What happens then when it reaches 1, and when do you project that will happen?
Well, Ria, it's probably going to happen with the numbers today that it will exceed 1 because it's so close to 1 already. Well, I mean, it's not going to change anything, but of course, if the ADAR or increases even further, then we will monitor this closely because the surge or the pending week surge will be closely related to the ADAR. But in context, last January, the ADAR actually reached 100. I mean, during the first Omicron wave, so that it was that high. So right now, it's still just going to be increasing past 1. So it might be moving from very low to low. So it will still be at low ADAR once it exceeds 1. But yeah, like I mentioned, we're monitoring this closely to see how high it will be going up.
Right, and we're also really looking at the healthcare utilization rate, which thankfully has remained really low. But Professor, what is your projection? I mean, until when can we expect these cases to increase, and what is it going to look like at the peak? Are we at the peak?
Well, we're not yet at the peak, Ria. So we're expecting the peak to hit sometime end of June or first week of July, around that time. There's a margin of error there. And right now, the projections show a peak of around a few hundred cases in Metro Manila, maybe 400 or 500 cases per day. So like I mentioned, it will be relatively mild in terms of the surge. We also expect that the cases will somehow leak out to other provinces as well eventually. Right now, the Calabarzon is also feeling this increase in cases, the slight increase in cases, particularly Rizal and Cavite.
All right, well, here's hoping, those numbers stay in a very good place. Always good to talk to you, Professor. That was OCTA Research Fellow Professor Guido David.